let's look at healthcare reform. It is issue number one on President Obama's agenda. That is clear. And he says he'll be able to accomplish it, likely including a public plan. That's what he'd like to see without adding to the deficit. We're talking about a $1 trillion plus price tag. Warren, is that possible?
Well, we'll see when the bill comes out. I mean, but as you say, the CBO scored it at $1 trillion, and he has said not a dime, and you can design a plan that is not a dime, but we will have to see what comes out of the Congress on that.
We're expecting to see something soon from Congress on health care. You supported President Obama
100%,
publicly,
yeah.
100% you say. Do you support him right now in his health care push?
Well, we still haven't seen the final plan. I think that, unfortunately, not because of President Obama, but just because of the way the debate has taken place, it's become much more of a question of health insurance reform than it has been health care reform. In terms of how health care, the incentives in the system, the delivery system, all of that, doesn't look to me at this moment may get changed very fundamentally. We may broaden the coverage, which I'm 100% for, but if you talk to the medical experts, a lot of them say that the real problem is the incentives in the present system, and that you need to change the delivery of health care much more than you need to change the insurance.
Yeah, they call it a medical loss ratio. You look at running a business to make money off of, the fewer people you cover for the less amount, the more money the business makes. It's a hard issue right now. There are insurance companies that would argue, and lobbyists, that creating a public plan would push them, private insurers, right out of the system. Is that a fair concern?
It depends on how the public system would be conducted. I mean, if it's conducted at lower than cost, if it's subsidized in some way, obviously a private plan can't compete with that. But it would depend entirely on the private alternative. And in workers' compensation insurance, for example, in California, there's a very large public option in effect, and it's coexisted with private insurers for many decades. But it all depends on how it's set up. If the government system is subsidized in some significant way, obviously the private system can't compete with it.
When we look at the critics of Obama, this has become an incredibly heated debate, and there are those that will go as far as to call his policies socialist. How do you respond to that?
Well, he's not a socialist, but and neither is the American U.S. Congress. I mean, government has a big part in our lives. I mean, 20% on average of the last, well, since World War II, almost 20% on average of GDP is run through government now. So you've got a very big government, but you do not have government running businesses or directing the output. But government is a big factor. It's always going to be a big factor in our lives. We want it that way. I mean, we have a very rich society. We want to take care of people that are 65 and over, for example, in terms of Social Security. We couldn't have done it back in 1800, but by 1935 we had a country that could handle that. We wanted Medicare. The thought of in a very rich country people worrying about basic health care in their old age, that's abhorrent to the American people. So we have had government take on more and more as we become more prosperous.